Well, a couple other things that the average citizen cares about, education and healthcare. So let's start with healthcare. Really tough in this country to think about how to deal with healthcare. Can you talk a little bit about how you see the issues of healthcare, issues of insurance? I know you've tried to work on drug pricing with pharma. Talk a little bit about that, because one of the things that's happening is states are experimenting in ways that the federal government cannot. And
yeah, look, I mean, well, one, I mean, a lot of the problems are federal. It's just the reality. I mean, they've gotten so intertwined with this. We have a medical industrial complex, kind of what Eisenhower warned about with defense. You know, well, that has happened too, but that has happened, you know, with insurance and the hospital systems and all these other things. And so, you know, we have, you know, somewhat limited ability to really make an impact here. So a couple of things. One, we did do the pharmacy benefit manager thing, so we were able to squeeze out savings by exposing some of that for folks. Two, you know, if you want something to be cheaper, you have to have price signals, right? I mean, a market, if like, imagine like, you know, I want to take the kids to In-N-Out Burger since we don't have that in Florida. If they didn't tell you how much a double costs, like, you know, what are you going to do? Like if it's $30, then I'm not taking them, right? And so you need to have that. And that's how a market works. No one knows how much this stuff costs with respect to medical. So we did a price transparency reform. They have to put the prices up. So if you're in Tampa, you know, one side of town, a hip replacement is X, other side of town, it's Y. And so that's helpful. The problem is, if it's all third-party payer, what do you care as the patient? If it's just insurance is going to pay for it, then choosing the cheaper one doesn't make sense. So what we did with our state employees, we did something called shared savings. So you have the transparency, and if they opt for a more cost-effective way, then they get rebated in the lower premiums. So it saved the state taxpayers millions and millions of dollars. It's obviously saved the employees money out of pocket. We've done that. We have not applied that a mandate for the state. So there may be some companies that are doing it on their own. Maybe some employers are negotiating that, but we've tried to do it. I think that what we want and what the federal government really won't allow is most people, particularly under 50, what they really need is a catastrophic plan that's affordable, where then they can pay whatever they're doing out of a health savings account. You know, most people outside of paying insurance premiums are not paying a lot for medical on a routine basis. I mean, I know in the Navy, they told me to take something, I would do it. But other than that, I never did, right? And so that's where you got to get to. I think what the federal government does, it makes it very difficult. And the bigger government gets, the more intertwined it gets, that facilitates what we've seen with the consolidation, where the hospitals will hire all the physicians. Private practice, medical practice is becoming a lost art compared to what it was when I was a kid. First of all, I don't think that that's a good way to incentivize great people to want to be in medicine. I think 50 years ago, you looked at that career, it's probably more lucrative and fulfilling than what you have to deal with now. And there are some very good doctors who've been for 30, 40 years who tell young people now, I'm not sure I would do it because of having to deal with all this stuff. It's like, did you sign up to help treat people and cure people, or to be some type of a bureaucrat, a cog in the machine where you're having to deal with a bunch of red tape? So I think most of the problems with healthcare are because of what they've done in Washington, D.C. over many, many years.